Okay, let me get started. It's 9 o'clock now, and our speakers are there. Good morning, everyone, and good evening to our audience joining from Korea. Welcome to GW Institute for Korean Studies, or GWIX. I'm Yeonho Kim, Associate Director at GWIX, and thank you for joining our Korea Policy Forum. The forum is part of the policy program at GWIX, focusing on discussing current Korea-related policy issues in the domestic, regional, and global context. And today's forum is, as always, co-sponsored by the East Asia National Resource Center. And for your information, we will send out a separate email to the attendees with a survey on today's webinar. So please fill it out and send it back to us. It'll be greatly appreciated. As the world is reeling from the coronavirus pandemic, South Korea has emerged as a model of effective testing, contact tracing, and treatment. And it is really remarkable that South Korea succeeded in flattening the curve without any lockdowns or travel restrictions. And last week, as you know, South Koreans even held the world's first general election in the coronavirus era, with even a record high turnout rate. So I think the South Korean case would provide a rare example of how the coronavirus pandemic management could work. And today I'm very excited to have an opportunity to hear from senior Korean officials and a renowned expert about their firsthand experiences. They're joining us from Seoul. I'd like to thank all the speakers and their teams for staying up late at night for us. Let me briefly introduce our speakers. Our first speaker is Chang, Deputy Minister for International Affairs of the Ministry of Economy and Finance. He formerly served as Director General for the Development Finance Bureau and Senior Director for the International Economic Policy Division. And our next speaker is Hee-kwon Chung, Director General for the International Cooperation Bureau of the Ministry of Science and ICT. He also served as President of the Seoul Office of Central Radio Management Service and Director of the Public-Private Joint Task Force for the Creative Economy on the Presidential Advisory Council for Science and Technology. And last but not the least, Moran Ki, an epidemiologist and professor in the Department of Cancer Control and Population Health at the National Cancer Center Graduate School of Cancer. She was a professor in the Department of Preventive Medicine at Ulchi University and the Dean of Ulchi University's Graduate School of Public Health. And here is how the speakers will discuss South Korea's response to the coronavirus. So Deputy Minister Ha will discuss the South Korea's public health and economic and financial measures. And Director General Chang will discuss the use of science and technology in dealing with the pandemic. And Professor Ki will join the Q&A session and taking your questions about South Korea's public health response to COVID-19. So you can type in your questions in the Q&A box on the right-hand side panel on your screen. And please make sure to identify your name and affiliation when you submit your questions. So with that, let me turn it over to Deputy Minister.
Thank you. Yeah. Thank you, Mr. Kim, for hosting this video conference today. I would like to share health and quarantine measures as well as economic and financial measures of the Korean government to tackle COVID-19. First of all, the the next slide. Actually, Korea is still reporting new confirmed patients and deaths. However, Korea has flattened the COVID-19 curves as the number of newly confirmed cases has remained at double digits for more than 27 straight days. As of April 21, the number of confirmed patients stood at 10,683, while the number of deaths totaled 237. Korea has worked its way into the deceleration phase, with the number of people being released from self-quarantine every day surpassing that of newly confirmed patients. And next, with new infections still being reported, it is premature for the Korean government to relieve tension. Instead, we need to continue our efforts to further contain the viral spread. While preventive measures are of the highest priority, the Korean government has focused on maintaining a proper balance between preventing the virus spread and minimizing economic shocks by ensuring necessary mobility and openness. For instance, without imposing general border control and entry ban, Korea has instead worked on effective screening of potential carriers. In this regard, I would like to emphasize three T's and the participation that were essential to health and quarantine measures of the Korean government. First, testing. The Korean government has been conducting an impressive number of tests within a short period of time. Korea has raised the daily testing capacity to 15,000 and 20,000 and has conducted over 460,000 tests so far. To ensure access to testing while minimizing the possibility of infection, Korea has also set up separate testing facilities within medical institutions and introduced drive-through and walking-through testing. Second, tracing. The Korean government takes vigorous measures to track and test those who have been in contact with confirmed patients, utilizing credit card transactions, CCTV recordings, and GPS data on mobile phones when it is necessary. The close contacts identified through epidemiological investigations are put under self-quarantine and monitored. The government also mandates the disclosure of the whereabouts, means of transportation, healthcare institutions visited, and the contacts of confirmed cases. Third, treating. To hospitalize patients with severe symptoms and provide appropriate treatment options to other confirmed cases, the Korean government classified patients based on severity and places them accordingly in hospitals and living and treatment support centers. The Korean government also ensures hospital accessibility and safety for non-COVID-19 patients by designating so-called safe hospitals that separate respiratory patients from non-respiratory patients. Fourth, voluntary participation. A high level of civic awareness and voluntary cooperation have been the biggest factors limiting the spread of the highly contagious virus, and three T's make work. When we take measures against COVID-19, next slide, we should consider three factors: the spillover effects from confirmed patients and deaths, and economic losses due to social distancing and lockdown, and the possible weakness of social cohesion from income by polarization. We need to hit the right balance among the three factors, considering each country's specific situation. With this in mind, Korea has implemented phased economic measures for the initial phase of the coronavirus outbreak. The total volume of emergency relief fund stands at 240 trillion won, around $190 billion, amounting for 12.5% of GDP. At initial stage, the government has been responding swiftly to slow contagion, starting urgent quarantines. We provided 82 trillion won financial support to counter damage to the real economy and 135 trillion won in financing to maintain financial stability and a 18 trillion won emergency disaster relief fund, as well as economic measures to reduce the financial burden on the public, including payment deferral. I would like to explain the Korean government's policy measures and differ by targeted recipients for financial support with the aim of minimizing economic loss due to COVID-19. First, economic policies for SMEs and micro business owners. For SMEs and micro business owners or self-employed business, the government is helping to relieve the burden of their business costs, deal with urgent financial difficulties, and increase sales. To relieve the business cost, we are working to ease the burden of labor costs and help stabilize labor market with subsidies to retain their current level of employees. In addition, we are providing tax reduction for building owners who voluntarily reduce rent. Measures to back financial support include an emergency business operation fund with a very low interest rate. The government is also supporting credit recovery program by extending loan maturities, deferring interest payments, and reduced debt. The government has promoted consumer spending through the Emergency Disaster Relief Fund and increased the earned income credits, which helped the small businesses and the micro business owners increase sales. And next, economic policies for companies above the mid-sized level. For companies above the mid-sized level with a little bit more room for survival, the policy focus is on securing liquidity and export support. For secure liquidity, measures include guaranteeing liquidity across industries through the prompt undertaking of corporate bonds and export performance-based loans. Liquidity for businesses that are performing well can be secured through the operation of bond stabilization funds. For supporting export, the government is providing support for overseas marketing, expediting customs. We have expanded the scope of flexibility in tax payments through the payment of custom duties in installment and early customs refunds. Next, economic policies for industries that were hard hit by COVID-19. Policies are targeting the airline, shipping, movement making, and the tourism industries that are hard hit by the coronavirus pandemic. For the airline and shipping industries, the government is injecting liquidity. Additionally, we have come up with measures to mitigate the range of usage fees and rents, give a probation period of retrieving the operational rights and the slots. For the movie-making industry, the government is providing film production giants and on-site vocational training, film production grants, and on-site vocational training for movie makers. For the tourism industry, the government is putting off hotel ratings and pushing down the fees for safety checks at amusement park. Additionally, government is planning to provide liquidity injection totaling 40 trillion won for cash-strapped key industries. Next, regarding the support for ordinary citizens, the government plans to provide emergency disaster relief for income earners at the 70th percentile as well as cut and defer the payment of social insurance premiums. This measure is under discussion, and I think it will be expanded to include 100% of the people. Yeah. Regarding the worsening job market, the government is also providing emergency relief for those outside of unemployment insurance and creating jobs for low-income groups and the young adults with the job seeker benefits and the job training program. Lastly, the global economy during the post-COVID-19 period. The COVID-19 period situation is unlikely to end in the near future, and it will leave lasting effects on the global economy. Also, structural difference. It will make structural difference post-COVID and before COVID. It is expected that restrictions such as social distancing will be gradually eased. However, in post-COVID-19 era, it will be difficult to maintain the worldwide interconnectedness of goods and services unaffected. In this situation, individual countries need to maintain their active macroeconomic policy stance for a considerable period of time after the COVID-19 crisis has peaked. At the same time, we need to upgrade our economic structure to be suitable for post-COVID environments. The trend of fourth industrial revolution will be accelerated. We should promote artificial intelligence, big data, digital-based non-contact industries, as well as make traditional industries much more smarter. Thank you very much.
Thank you, Deputy Minister Hao, for your comprehensive outline of what's going on in South Korea. Let me turn it over to Director General Chang.
Yes. Thank you. Yeah, my name is Chang, and I will present regarding how Korea tackled the issues of COVID-19 from the perspective of science and ICT. Next slide. Yeah, this is the agenda for today's presentation. Next slide. Yeah, maybe Mr. Ho already presented Korea's current situation, so I skip this slide. Next slide. Yeah. Maybe there are 4 pillars to how to combat with the current situation of the COVID-19. We have the 4 pillars. First one is testing. The second one is tracing. The third one is treatment, and lastly, social distancing is important factor. How can Korea to handle that kind of situation, difficult situation of COVID-19? Next slide. The first one, I will talk about the COVID-19 testing. Next slide. Yeah. In the case of Korea, test kit is a very important factor how to handle this COVID-19, because COVID-19 is an unknown virus. It is very important how quickly we develop the test kits. So Korean government do a lot of effort before the COVID-19. So we spend a lot of R&D investment regarding the developing test kits. So 5 companies got the emergency use approval. Of the 5 companies, over the 3 companies got the government R&D fund to develop the test kits. So they got on average $1 million government fund to develop funds. So they acquired technological capability through government R&D, and also in the case of CGen, one of the successful test kit company, they use the artificial intelligence to shorten the process. So it only takes usually 3 or 4 weeks to develop the kits. That is the main success factor how to Korea can handle the test kit issues. Next slide. And also, some of the Korean startup companies, such as Junos and Unit, developed the technology detecting abnormal lung condition of COVID-19. They train AI algorithm with large-scale chest X-ray photographic data, so they can detect the COVID-19 within just few seconds. So it is very useful to diagnose the COVID-19. Next slide. Second issue is regarding contact tracing. Next slide. We use the self-quarantine safety app for the people who enter the Korea and also the self-quarantined people. And they usually use the 2 purposes. The one is the self-diagnosis to monitor the symptoms of the self-quarantined people. And the another one is the sending the alarm to violate self-quarantine rules. So we use the self-quarantine safety app to contact tracing. Next slide. And also the important thing is that as you see the some of the graph, the COVID-19 infected patients grow exponentially. So it is very important to epidemiological investigation should be finished as soon as possible. So we made some kind of data systems that combines overseas roaming data and card transactions and CCTV, that kind of things. So for the manual analysis, it took almost a day, but by automatic analysis, it just takes just 10 minutes. So, but there is still a privacy concern, so government to do some kind of activity for the privacy protection, such as the activity of each user under strict surveillance, or all data to be deleted after COVID-19 is over. Next slide. Also, COVID-19 treatment is very important. We are doing some basic research regarding to how to understand the COVID-19, and one Korean institute, the Institute for Basic Science of Korean scientists, analyzed, completed a high-resolution gene map of SARS-CoV-19 and published the articles on the cells. Next slide. And it takes a lot of time to develop new drugs for the COVID-19. So our government is doing drug repurposing. So we are screening 1,000 or 2,000 drugs of each drug. So we found 20 drugs which is effective against COVID-19, and we are doing clinical trial using a sequencing is on the way. Next slide. And also open infrastructure for the research for the COVID-19 is important. We opened 2 websites, such as the Quora and DataOn, to share the information regarding the COVID-19. Also, we are developing new personal protective equipment materials for frontier workers, just such as the anti-fog goggles and improved antiviral masks. Next slide. And also, social distancing is very important. Next slide. we used modeling to assess the effectiveness of the government policy regarding the social distance. So we already made some research networks of different agencies, researchers, and one of the research results by the KIST indicated that the graph showed that a strict social distance is enforced. It's just like the green graph, but the actual number is the red graph, and it's almost same. So we understand that the strict social distance is enforced in Korea. That is the reason why Korean policy is succeeding. Next slide. Because the current situation, it is difficult to physical contact because of social distancing. So government is support for the remote learning and working. We provide remote learning device such as Edison, and also we generate for the educational website EBS and IPTV and TV providers broadcast real-time EBS educational content. And also for the remote working, government provide website providing information about the remote working solutions. And also public side, government use GVPN and video conferencing for the teleconferencing. Next slide. Currently, US is also facing the shortage of the masks, and Korea also experienced that. So because of the shortage of mask supply, we can buy 2 masks per person per week. But the difficulty is that people face difficulty finding where is the mask is available in the pharmacy. So government provide public mask sales data. So it is a open API format. So each developer develop the website so government can access to that kind of information and easily can buy the mask these days. Next slide. Yes. In conclusion, next slide. It is difficult to apply Korea's COVID-19 response model in the US because the systems are a little bit different. Because we have a very universal healthcare systems, but United States is a very fragmented system, and also there is a very difficult government structures, state government and also the federal government. So maybe it's not easy to apply directly, but I think that Korea's experience, even though that kind of there is a difference, Korea's experience and best practice needed to be shared to respond to the second wave of COVID-19. And Korea will work together with the US by regularly sharing policy practice and other valuable experience. Thank you for your attention.
Thank you, Director General Chang. As I announced at the beginning, we're taking questions from the attendees. When you look at the right-hand side of your screen, you can see Q&A box. So please send us your questions with your name and affiliation. So while we are waiting for the questions from the attendees, let me ask a couple of questions for Professor Moran Ki. So from Deputy Minister Ho and Director General Chung, we had a lot of information about testing and tracing and even treatment, but on the ground, as an epidemiologist, I wonder how the treatment is going on in Korea. So far, what kind of treatment have been identified as the most effective treatment did you observe? Please unmute your microphone, Professor Key.
Can you hear me?
Yes, I can hear you now.
Okay. Actually, I'm not a clinician. I'm epidemiologist, but I can say nobody has really effective treatment for COVID-19 yet. But fortunately, more than 80% of patients showing mild symptoms, and then mostly they didn't need any treatment, so they can recover. They can recover by themselves, and then some of them, about 15 to 17%, showing need some oxygen therapy, and then about 2 to 3% need ICU therapy, intensive care unit. So in this situation, we need a kind of artificial ventilator or sometimes ECMO therapy. Okay.
Thank you. And one more follow-up question for Professor Moran Key. I understand both in the United States and South Korea, probably other countries also, there are some patients that tested positive for coronavirus, even if they were declared as cured. So this kind of a mysterious thing is going on right now. And how serious do you think this is? And do you have any effective way to address this problem?
Yeah. Okay. When they cure means there are no more virus in RT-PCR test. But some of them, in Korean data, it was about 2 to 3% showing the virus positive after they cured about 1 to 3 weeks. But there are 3 hypotheses. The firstly, maybe reinfection, and secondly, reproduction, and then thirdly, some kind of remnant of virus. But in Korea, the incidence rate is very low, so reinfection possibility is also very low. And then also the virus remnant, sometimes the virus remnant is very little, so it's hard to find. So we are thinking maybe the possibility is reprogression. So the virus revitalized, and then their reproduction. That means the patient immunity is not perfect. So some of the patients, even though after their treatment finished, their immunity is still very low, so the virus recur again.
Thank you. We have a couple of questions from the attendees. Let me take the first question from Madison Hernessen from the Washington Times. The question is, what is the biggest lesson the US and the world could learn from South Korea's response to the virus? I think this question addresses to all 3 speakers. So whoever wants to speak first, please raise your hand. Professor Moran Key, do you want to go first?
Yeah, I'm not sure which one is the best lessons, but because we are still fighting to the virus, and then we are not sure because the war is not the end. But I think when you think about preparedness and response, for the preparedness, our preparedness is not perfect. Actually, we experienced MERS, Middle East Respiratory Syndrome, by coronavirus in 2015. So after that, our public health people or all medical personnel said you have to change it after the MERS. So actually, we changed several things. For example, EIS officer, epidemiologic investigation service officer, and then we also changed the hospital infection possibility, and then we also changed the regulation, the law. And then we have many plans actually, but we could not finish it yet. And then for the not preparedness for the response side, when you think about response side, there are two parts: decrease incidence of case and decrease case fatality part. For the decrease incidence case, we did several things. For example, wearing face mask and hand hygiene and environmental hygiene, and also social distancing. And then for the decreasing case fatality, we did rigorous treatment. And then our treatment system is not best, but we can separate the patient by their severity, the mild case and severe case. So I think in other countries, if their goal is decrease case fatality rate, at first they should prepare the separating, categorizing system for the patient. So immediately separate triage system for the patient. So if they separate the mild case patient to a specific facility, and then if you only focus for the severe cases, then I think you can decrease the case fatality rate.
Thank you. To save our time, let me move on to next questions. This is for Director General Chang. Question from Mark Worcester. So his question is, could Director General Chang expand on artificial intelligence use for RT-PCR kit development and how it shortened kit development?
Yeah. The company Seagen amassed a lot of big data systems because they have a lot of experience of developing that kind of test kit. So they used artificial intelligence system based on the big data. So they made automated systems that make test kit as soon as possible. So they make them really helpful.
Thank you. Next question from HN Yusel. The central government, local government, municipalities, or the public itself. I think this attendee is trying to ask about the coordination between the central and the local governments. The social distancing is such a hard thing to practice in many countries, even though there are quarantine or curfews. So in Korea, how do you coordinate between the central government and the local governments? Probably the Deputy Minister, Todd, I think you may want to answer this question.
Yes. First, I will speak in Korean, and the translator will translate my word. And 무엇보다 한국에서 사회적 거리두기는 강제적으로 진행됐다기보다는 직장 업무 등 정상 수행을 전제로 해서 시행이 됐다고 봅니다. 교육, 체육시설 등 다중시설에서 많은 사람들이 집합적으로 모이는 상황을 방지하는 것에 초점을 두고 있습니다.
First of all, in Korea, social distancing was not made mandatory. So it was always based on the premise that our everyday activities would basically go on as normal. So for example, in the workplace, we would continue to perform our jobs. And the focus was to prevent large gatherings. So for example, in education facilities or sporting facilities.
예, 특히 그 환자들을 조기에 대량으로 검사를 해서 환자들을 확인을 하고 이 사람들에 대한 ICT 기술을 사용해서 이 사람들을 철저하게 어디 있는지 관리를 해왔기 때문에 상대적으로 이분들에 대해서 격리나 이런 거는 철저하게 했고, 반면에 소셜 디스턴싱 문제에 대해서는 상당히 우리 쪽은 자발적인 참여에 의해서 진행이 됐기 때문에 상당히 갈등도 적었고, 그리고 이제 미국에서 하듯이 전체를 블로킹하거나 그런 방식을 쓰지 않았고, 초기에 경북과 대구 쪽에서도 전체를 많이 코비드 환자의 60% 정도가 나왔을 때조차도 지역 전체를 블로킹하지는 않았습니다. 그렇기 때문에 사실상 경제 및 내수에 미치는 효과는 생각보다 그렇게 미국처럼 그렇게 크지는 않았다고 보이고, 시민들이 자발적 참여에 의해서 진행이 됐기 때문에 사실상 이 서로 간에 협조하는 데 큰 문제가 없었습니다.
And from the beginning, we have conducted massive testing in order to identify patients. And such patients, the confirmed patients who were thus identified, were monitored for their whereabouts using ICT. So for the confirmed patients, quarantining them and monitoring them was not that difficult. And when it comes to social distancing, it was based on voluntary participation by the citizens. So there were not that many conflicts in implementing this. And we did not block any specific regions. And even in the early days of the transmission, when we had the geographic cluster in the city of Daegu and also in the larger area of North Gyeongsang province, that is where we had about 60% of our confirmed cases at that time. And even at that time, we did not block that region. So I would say that the impact on Korea's domestic economy and domestic demand had been not as large as perhaps it was in the US. And again, the social distancing was based on volunteer participation, and it was not too difficult to draw out cooperation from the citizens.
그리고 또한 한국의 경우에는 마스크 생산량이 하루에 1,300만 장 정도 되는데, 인구가 5천만 명 정도가 됨을 감안할 때 전체가 다 마스크를 쓸 수가 있었습니다. 그렇기 때문에 상대적으로 이 사회적 거리두기를 사회적으로 이 전염의 가능성을 상당히 줄였다고 볼 수 있습니다.
And Korea's mask production was about 13 million per day. And given that we have a population of 50 million, so it meant that we had enough to provide every members of the Korean population with the masks. So because of this, implementing social distancing was made, I would say, easier, and it was also helpful in preventing transmission.
Thank you. Next question is from Scott Schneider at Council on Foreign Relations, and I think this question might be addressed to Professor Moran-ki. What is the status and scope of antibody testing in South Korea? Are there plans to factor such tests into Korea's back-to-work plans?
Yeah. Okay. Regarding the antibody testing, actually, we are not believe the antibody effectiveness because actually nowadays we don't know the real antibody effect. If somebody who have antibody, is it real protective effect or just the kind of history of infection? So we have planned to test a specific area, Daegu and Gyeongbok, for antibody testing in coming May or June. But for other area, we don't have any plan. And then we need to study more about the antibody effectiveness using the patient cohort. So we just test the antibody effectiveness, how long their antibody going on, and then how the antibody protective against the virus.
Thank you. The next question is from Paul Tyson. It's about the supply of test reagent. So probably, again, Professor Moran-Ki or Director General Chang might want to answer this question. So the question is, how is Korea's current supply of test reagents? Is there a possibility that there will be a surplus available for export to the United States in the coming months?
I could not find their questions.
Again, let me read the question again. If Director General Chang is going to answer the question, then please go ahead. It's about the current supply of test reagents.
Yeah. As I from the company, the Korean company export more than 90% of their test kit to the overseas. So just less than 10% is used for the Korean. So I think, yeah, also they are expanding the capacity. So yeah, there is no problems, yeah, to send test kit in the United States, as I know.
Professor Moran-Ki, do you have anything to add?
No.
Okay, thank you. Next question is from Namsu Park. So this question is for Deputy Minister Hall. So could you please provide examples of economic policies which a developing country can consider for effective recovery from COVID-19 based on the lessons from Korea? So the implications for developing countries.
예, 한국의 경우에는 일단은 그 대부분 이제 제조업 기반이 강하고 그리고 많은 경우에 있어서 이제 최초에 이제 내수의 충격이 있었지만은 지금은 이제 사회적 거리두기도 그렇고 내수의 충격이 조금씩 완화되고 있는 상황이기 때문에 코비드의 가 조금 잡히면서 상대적으로 그 부분은 상당히 좀 개선돼 있다고 봅니다. 그렇지만은 한국의 경우에는 지금 수출 해외 시장이 여건이 악화됨으로써 수출 기업이라든지 이쪽 뭐 주력 기업 쪽에서 이 수요가 떨어지는 그러한 문제들이 있어서 한국의 경우에는 일단은 첫 번째로 이제 현재는 이제 그런 기업들을 자금난을 하는 게 첫 번째고, 그 다음에 두 번째로는 이 취약계층에 있어서 예를 들어서 한국이 그 노동자들이라든지 아니면 조그마한 중소기업들 그리고 작은 자영업자들이 많습니다. 그래서 이분들이 자금 사정에 어려움을 많이 느끼기 때문에 이분들한테 자금을 어떻게 지원해 주느냐, 이런 취약계층 지원과 기업 지원 두 개로 나눌 수 있는데, 아마 기업 지원 쪽에서는 개도국은 크게 개도국 입장에서는 크게 참고가 많이 될 것 같지는 않고, 주로 취약계층 지원 쪽에 있어서는 참고할 만한 게 일부 있다고 할 수 있겠습니다.
Now, for Korea, we have a very strong manufacturing base. And now, in the early days of the COVID-19 outbreak, our domestic consumption also took a hit. But then, over time, as the number of COVID cases subsided, so did the stress on the domestic consumption. So now we see that things have much improved in terms of domestic consumption. But now then, the issue is with the overseas export market. Korea also has a lot of exporting companies, and now many of these exporters are faced with financial crunch. So we are trying to support them in terms of the liquidity and the financial stresses. And second is supporting the disadvantaged groups. For example, workers and also a lot of small businesses and also self-employed who would find themselves financially strapped in this time. And now for the developing countries, perhaps it would be maybe they can take more lessons from our support for disadvantaged groups.
예, 첫 번째로 그 취약한 계층, 조그마한 중소기업이라든지 자영업자들을 위해서는 저희들이 한 100조 정도의 그 지원 펀드를 마련해서 그분들에게 유동성을 지원하고 있습니다.
So then, for the disadvantaged groups, for example, micro enterprises or the self-employed, we have come up with a 100 trillion won fund to support them with liquidity.
그리고 그 실업한 분들을 위해서 실업보험에 대한 지원 기간이나 규모도 늘리고 있고, 그리고 비정규직이라든지 이 고용이 불안정한 분들에 대해서도 특별한 지원책을 추진하고 있습니다.
And for the unemployment insurance benefits, we have also extended the duration of the benefits payout as well as in the amount of the benefits as well. And we are also trying to broaden our support for the irregular workers, the precarious workers.
또한 이들에 대한 지원을 할 때 또한 IT라든지 최근에 노동 교육을 다시 받고 에듀케이션 프로그램 등을 통해서 이들의 그 역량을 높이는 노력도 같이 하고 있습니다.
And along with such financial support, we are also providing retraining opportunities for the workers so that they will be able to get retraining to find other jobs.
그리고 최근에 있어서는 약 10조 정도의 자금을 통해서 이 모든 국민들에게 특히 취약계층을 중심으로 한 대부분의 국민들에게 한 가구당 100만 원 정도의 금액을 지원하는 프로그램을 추진했습니다.
And more recently, we are now trying to implement a program of providing 1 million won per household, for all households in Korea, using about 10 trillion won budget.
예, 이상이라고 할 수 있습니다.
That is all. Thank you.
Thank you. Our next question is from Turkey. Hatis Selik from Turkey, the chair of Asian Studies Master Program in Ankara Social Sciences University. Thank you very much for joining us from Turkey. So the question I have here is, does South Korea plan to have all population tested, or is not a necessary option to fight against COVID-19? Probably Professor Moranki, do you want to go first?
Yeah, testing for all population is not possible and it's not effective. But we are testing for hospital. How can you say 요양병원?
Nursing home?
Yeah, kind of nursing home, and because they are a risky population, so we are doing monitoring for all nursing homes in our country. So to increase the effectiveness, we introduce pooling system. So when you test for nursing home, we test 10 persons sample at one time. So if, for example, the nursing home have 100 people, then we test each 10 persons pool. And then if they are all negative, it's okay. But if we have one positive pooling, then we can test again for each individual. So for nursing home, you have all tests, but not all population. Okay.
Thank you. Next question, I think, because we have only 5 minutes left, I think all three speakers can address this question. It's very broad, the question. From Toyomi Asano, when and how would the quarantine of Korean society be finished and normalized? Under what kind of conditions would be indispensable to do this? So I think this is a question that everybody in the world have in their mind. So when can we go back to the normalcy, and how can that be happen?
Yeah, yes, I will be very brief. As a matter of fact, I think that the COVID-19 we can contain COVID-19, but the COVID-19 cannot be vanished in a short period. I think so. So we do not think about even though we prepare for the post-COVID-19 and prepares what kind of industry and what kind of the industrial structure we will be, but we are imagining and we are preparing the projects for the future. But at the same time, we have in mind, actually, we go press in a considerable time, we might go hand in hand with the COVID-19, and we should strengthen our capacity for against COVID-19 in the case of the health system or other related systems to go against take measure against for COVID-19, but we also should think that there will be another kind of the pandemic after the COVID-19, and I think we should prepare for such kind of the possibilities also. Thank you.
Director General Chang. Yes, please.
Yeah. From the Ministry of Science and Technology's perspective, we think that vaccines and drugs will help that can stop that kind of pandemics. But there is a very diverse opinion from the science community. Some scientists said that it will be solved within a year or 2 years, but some scientists said that it is very difficult to develop vaccines to tackle the COVID-19, so we do not sure about it.
Yes, thank you. Even South Korea is very cautious about going back to normalcy. And Professor Moranki, please.
Yeah, I think there are not much time. I think we cannot go back to the before COVID-19 era. I think we have to live with COVID-19 forever. So we have to change our lifestyle and our working style, and then our public health system to live with the virus. Okay.
Thank you. And with that, I think I'll have to conclude today's webinar, even though we have some more questions for the speakers, but I wish I could take all the questions, but we're out of time. So I'd like to thank all the speakers for taking their time and stay up late at night, and our technical team for putting this together. And thank you all for joining us. Stay safe and healthy. Thank you.